Dr. Muni, welcome to this discussion.
Thank you very much.
Could you quickly introduce yourself before we delve into our discussion for the day?
I'm Dr. Mutinta Muni, obstetrician gynecologist.
Right. Dr. Muni, can we delve into the issue of infertility? Could you begin by defining what infertility is?
Okay. Infertility is a major problem. It's a problem particularly in our setting that is shrouded with many misunderstandings and a lot of stigma. People, who are not able to have children are looked out as downcast, in the society. And it's something that is difficult even for the couples involved to seek care for. But it's always better to try and seek help and see what can be done, because in some instances the solution is not too far off. And I must say, in Zambia we have many options now for a number of women who have, I say women because I deal mostly with women, a number of couples. Because when we talk about infertility, we don't talk about infertility of the individual. It's infertility of the couple. And so, what is infertility to start with?
Right.
It's failure of a couple to achieve a viable pregnancy after 1 year of regular and protected intercourse. So this couple has been meeting intimately, but 1 year of trying and has not yielded a pregnancy. In some instances, we also talk about secondary infertility. In this event, there may have been a child at some point, a child or a pregnancy or a miscarriage, ectopic pregnancy, any pregnancy, but after that, conceiving has not been possible. And so this is termed as secondary infertility.
Right. So you have primary and secondary infertility, as you have explained. Now, what are the causes of infertility?
Okay. There are a number of causes of infertility, and perhaps we can look at them in two ways, which is why we talk about infertility of the couple.
Right.
I know, though, about 30% of infertility can be attributed to male factor. 30% also can be attributed to female factor, while the other part is not well known why.
Okay.
You have checked everything, but still no conception is going on. When we are starting the journey of investigating causes of infertility, as a couple, we have to sit down and count the cost. Because these investigations will reveal invariably, in most cases, whether the male in the couple is the one with the challenge, or whether it is the woman, or whether it is both, or the cause is not known. And so, as a couple, you sit down, because the intention isn't, if I find out my husband cannot have children, I start verbal abuse. Or if I find out my wife is not able for some reason to conceive, and I discover that I am okay as the male partner, I start verbal abuse or putting her down while chasing after other women. This should be discouraged. And this is what I say about counting the cost. So let's talk about male factor infertility. There are certain factors that may affect the quality of the sperm. The sperms themselves, the male cells, they must be of normal appearance. Sometimes due to genetics or due to disease, there may be some abnormalities in the forms of the sperms. there may be even a man producing what we see as semen, the ejaculate, but within that fluid there are no sperm cells. And this may arise because of blockages in the reproductive system, in the testes, in the vas deferens, where these are the tubes through which semen comes through. There may be blockages, but the sperm is there in the testicles. There may be also blockages due to disease that may arise. Sometimes someone may have had other conditions and was receiving treatment for things like cancer, underwent radiation, and of course, as a result, they are no longer able to reproduce. History also of mumps in childhood or in adulthood may have also affected the capacity of men to reproduce. But you wouldn't know by looking at the quality of the sperm or perhaps someone's vigor. You have to check first. Do a simple test which is done at most of the hospitals, most of the labs in Lusaka, and even at most provincial centers. They are able to do semen analysis tests. In some instances, there are also problems with the sexual act itself. Sometimes couples are unable to consummate because of low hormones like testosterone. And some people may be male in appearance, but genetically not so. And so these are some of the factors that affect the quality of the sperm. It may be infection, it may be even trauma. It might have even been an operation. Maybe you fell from a tree, landed on a branch and injured your testes when you were younger, but cannot remember, and now as dealing with infertility. So infection, trauma, operations, treatment like radiotherapy, diseases like diabetes, hypothyroidism, that may affect the production of sperm in the long run, as well as some medications. So you do well to discuss with your doctor if you're already on certain medications like some antihypertensives. Let us get it straight. It is better to take the antihypertensives and remain alive than to have a good direction and be dead. And so let's be clear about which medications we are on, and don't stop taking your medications without guidance from your medical practitioner.
Right.
With regards to women, we look at a number more factors. The birth canal. Is there a patent vaginal passage through which successful intercourse can be carried out? Is the mouth of the womb able to transmit the sperm through? What about the tubes? These are the corridors or the passages from the birth canal up to the ovaries where the egg will come out from.
Go on.
The ovaries are the ones that release our eggs, and we are most reproductive, of course, in our late, early 20s to about 35. That's the best time, fertile period. As we get above 40, our fertility also goes down. For men, this is not necessarily the case, but for women, age factor is always something that we should be mindful of, particularly in this age where we are more prone as women. We are, getting better educated. We are striving as professionals, but it comes at a cost, because sometimes by the time we are now ready for childbearing, time for childbearing has also elapsed. And so we may have to resort to other modalities in order to get a successful pregnancy. So we look at all these factors. Am I ovulating? Ovulation is guided by hormones. And so this is largely determined by hormonal tests. Are my tubes open? We can check this using a test called hysterosalpingography, or HSG, where we push dye through the cervix and check if the tubes are open. A number of women say, I did an ultrasound and they said everything is okay. You cannot tell through an ultrasound if a woman's tubes are open or not. You can just see the womb and the ovaries. Beyond that, you cannot see much else. If there are any other factors such as fibroids growing on the womb, this can be seen also by ultrasound. Also of importance in terms of the causes is nowadays we also see one husband is working in Kalabo, the wife is working in Chipata, so distance between the couple may not allow for that regular intercourse to take place, and in some instances you may need guidance as to your time of intimacy and ovulation to achieve a successful pregnancy. But if you've been trying for more than a year, for those who are above 35, if you have been trying for 6 months without success, it's time to seek help and opinion from a medical practitioner who will be able to give some treatment options.
Now, I read an article somewhere in the tabloids that a young couple reported to the fertility clinic not having been able to get pregnant, only to discover that they were having sex the wrong way. The young man didn't know how to have sex. Instead of going into the vagina, he was going into the anal area. Have you had such instances?
We have had different incidences. Some people, and this is where we look at the diversity of different people. One's normal is not necessarily another's normal. But for you to achieve a pregnancy, there must be vaginal penetration. In some instances where it is not possible, for example, in a couple where the husband may have had an accident rendering him impotent, he is unable to penetrate. His testicles still function, but he is unable to penetrate sexually. In such cases, the sperm can be extracted from the testes, and then intrauterine insemination, or IVF more specifically, can be used. So in such cases, if the penetration is wrongly done, the simple advice is for how to do it properly. If that is not the case and the partner is unable to penetrate for any reason, there are other options such as intrauterine insemination, because some people are unable to penetrate because as they are about to penetrate, they may ejaculate from excitement. And this is just how they are. So in such instances, intrauterine insemination is a good option. In instances where we cannot get the semen directly and we need to extract the sperm from the testicles, IVF is a good option, or in vitro fertilization.
Now, clearly from the list of causes that you have listed, both from the female partner and male partner, I'm sure the solutions are many. So what are some of the interventions that people need to do to improve their fertility, especially those that don't have any obvious problems?
So So one of them, for example, is to avoid things like smoking. For male partners, to avoid very environments like that will expose you to a lot of heat in the area of the testes. We also want you to eat well, take a lot of fluid, exercise. If you are obese, according to your body mass index, and this you can find out from your doctor, if you are obese or too overweight, this is another risk factor for unexplained infertility. Lose weight, definitely it does go a long way to improve also your intimacy. Lose weight, and have sex at least regularly, minimum 2 or 3 times per week if you are aiming to conceive. Because sperm lasts in the vagina for about 3 to 5 days. The egg is available for fertilization for at least 1 day after ovulation. So you have a window period. And so signs of ovulation, slightly higher body temperature, increased mucus production from the lady. But in event that some of these simple interventions such as good nutrition, better lifestyle practices, in the event that these are not working, then the best is to treat according to the course.
Okay.
Now, frequently, we have also a situation where we see women saying, I took this pill and I fell pregnant. And some women might even have taken some strong hormonal therapy before. You know, in some instances, we also have what I would like to term as abuse of morning after pill, where your body is now confused. If you need to use a morning after pill every now and then, it means you must just be on a regular contraceptive method, for example. And so if you are on therapy and a friend has recommended, don't use it without finding out what is your situation. Because you may be drinking that ovulation inducing medicine and not knowing your husband has no sperm. So you are subjecting yourself to some side effects that can be quite unpleasant without knowing that the fault is in another direction, or the problem is in another direction. And so we try and treat according to cause. I think that is the best advice, other than good diet, regular intercourse, and good support. Stress in itself, sometimes even newlyweds, you are under so much pressure to conceive that you forget that there are other things in life even beyond pregnancy. Marriage largely is about companionship to start with. But once people have settled down and have relaxed, you'll find that even the male partner performs better. You know, stress sometimes produces erectile dysfunction.
Yes.
Even for women, when they are stressed, their periods are irregular, they may not ovulate. So if you tone down on to the hospital.
Dr. Mayoni, what would be your take-home message? Particularly, this issue of infertility seems to be affecting a lot of people. Even on this platform, we've received a lot of questions with regards to infertility. What would be your take-home message to couples and the society as a whole? Okay.
For society, I would urge that let's support our friends, our family who have these challenges. No one ever asked to be in that situation. Indeed, when we are trying, we never really know which side do we fall. So let's support each other. Let's stop asking, when is the baby coming? How come this hasn't happened? Even people who don't have children are just as good as anyone else and can be just as fulfilled. So let's not all add salt to injury by such comments. Let's just support our couples, those who are getting newly married and so on. Let's just support them through whatever they are doing. And for the couples, let's try a year, or those who are older than 35, let's try 6 months. If it's not working, let's seek advice. When I say seek advice, let's seek professional advice, because sometimes you'll be promised, and I've seen a lot of fertility remedies, containers and containers, 2.5 liters of drinks you have to take to conceive. But the problem may not be with one or the other partner. Sometimes it's with both. So let us try and find out what is the cause before we direct our actions. Let's avoid spending money on unnecessary interventions, because money is hard to come by. Our money, our investment should come to treatment options that are proven to work. Let's not leave it until, for example, we are in our late 40s to seek medical care for our infertility. Do it while you are in the good window period. In your 20s to 35, that's the best peak reproductive period. But if you marry late, for example, and you have had no choice, still see your doctor, so that together you are trying to conceive, and you can be given supplements to try and improve the quality of your eggs. So in summary, don't leave it to chance, and don't waste money trying options or treatments that may not work. Seek professional advice, and then take the professional advice accordingly. I'm glad to say that there are so many treatment options now available even in our midst. We didn't have IVF before. People had to travel to different countries to seek IVF, but now these are locally available interventions. Intrauterine insemination, these are locally available interventions, but you won't know where to access them or how to, get involved. And don't be discouraged so much by some of the costs that involved. If you look at how much money we spend on popcorn, bubble gum, biscuits, cars, clothes, that's a lot of money. But if you plan well, you can save enough money. And even in some of these facilities, if you talk to them, they can have a good payment plan according to your situation. So please, let's not just take it as our lot in life. Let's find out. Don't be scared. Find out, do something about your situation. If at all it succeeds, well and good. If it didn't succeed, well, at least you tried and you have some answers.
Right. Thank you, Dr. Muni, for coming through.
You're
and do have a nice day.
Thank you.